Yeah, sure.
So, good morning. So I hope you are doing well. It's last day of DevDays. So we have here two smaller presentations. So it will be 15 minutes presentation and then 5-minute question. And so it's my pleasure now to introduce Julian. He will speak about the Medical Informatics Initiative in Germany. So, the floor is yours.
Thank you. Morning, everybody, and welcome to this community talk. I'm going to present the Medical Informatics Initiative in Germany, but first, about me. Who am I? Hi, I'm Julian. I'm a research fellow at the Core Unit Digital Medicine and Interoperability in the Berlin Institute of Health at Charité in Berlin. So what we do is we have interop in our name, right? So most of what I do on a daily basis is profiling FHIR, designing FHIR, implement FHIR in the hospital, do conformance testing when we implement new systems in our infrastructure. And we're also close to research IT, so lots of projects are data sharing initiatives, and this is also where FHIR becomes more and more important. And the initiative I'm going to present this morning is one of the larger or the largest data sharing initiative in Germany. It's called the Medical Informatics Initiative. So what the MII in short does is promote reuse of routine clinical data. What this means is that we try to pull data from primary care, from the systems, and make it available for research. The initiative is funded by the Federal Ministry of Education and Research and includes more or less all university hospitals in Germany. So it's a really large data sharing initiative. In the initiative, we try to demonstrate value through clinical use cases. So there are a couple of different clinical use cases. And what the initiative also is trying to do is strengthen medical informatics as a discipline. So there's students inside of the university hospitals in medical informatics getting more people into the discipline, right? Bottom here, you see kind of the time frame. The initiative started in 2016, was kind of like the conceptual phase. And where we currently are is the development and networking phase. So most of the infrastructure is in an early state right now. And we are just entering the consolidation and further development phase. And you're going to see in the next couple of slides also where we are and what's up next for the initiative. I've mentioned this earlier. Here you have a map on Germany. The dots are the participating partners, mostly, as I said, university hospitals. The initiative is organized in 4 so-called consortia. So we have DI Future, HIMATE, Miracom, and Smith. You can see them in the colored codes there. And this is also the initiative where you have like kind of different use cases. Yeah, but they all agree on a common data set, which is FHIR-based, where we're going to get to in a couple of slides. But before, the central concept which this initiative implements is a data integration center. So all of the hospitals participating are building those so-called data integration centers, and those centers create the technical and organizational foundations for cross-site data exchange. Yeah? So what people in the data integration center do is write ETL pipelines, data extraction from primary systems. Yeah, they process the data, make it available in FHIR, for example, annotate the data like we joined SNOMED. We are implementing LOINC in the labs, so annotation is a big part, and transform data. And finally, what the data integration centers do is provide the data and make it retrievable in like a large data sharing infrastructure. like a high-level overview of what this data sharing infrastructure looks like. It's a federated data management, but we're trying to have, through FHIR, uniform data use across those sites worldwide, right? You have those consortia here. There, you have the data integration centers. They may share data between them, build similar infrastructures, use the same software, and but then you have like central services where, in the end, the goal is to have researchers pull data or send research scripts, for example, to those central services and make those research run on data from the combined consortia and the combined hospital data stores, right? And this is where FHIR comes in. So the MII is building, or is midway through building, this MII Core Data Set, as we call it. Yeah, and it's split into the base modules, which you see on the top. So diagnosis of patients, lab results, procedures, medication, patient resources, treatment cases, right? Those are in production right now. And in the phase where we're currently in, we are building those extension modules with kind of more complex data models and use cases, which are also more harder to get from the primary systems, right? In a structured way. What else is, we are on FHIR release 4 and will also stay there because it's aligned to the other stakeholders in the German healthcare system. And yeah, so right now, no intention to move to R5 or anything. It's all R4 in the moment. Then how do we develop this core data set? We have interdisciplinary teams, clinicians, researchers from the hospitals. We work together with them, collect the information that the researchers and clinicians want to share and collect. We use the Core platform for the information collection. Then we build FHIR logical models. And from there, more like the profiling teams do the FHIR profiling, build the implementation guides. We ballot all the implementation guides through HL7 Germany. We apply the revisions and updates and yeah, start modeling the improvements. And all the discussions about the MII are also on the Zulu platform. Yeah. Some design principles. When we started, we said all our implementation guides shall be compatible with the IPS where possible, so implement international patient summary. We use the German FHIR base profiles wherever possible, and we coordinate and harmonize our implementation guides and profiles with other German stakeholders like national agencies like the Gematik or KBV, which those organizations also do like national profiles and implementation guides. So it's like an ongoing process to harmonize with them. Then, so where do we publish our guides? Right now we're using the Simplifier platform to publish our IGs. We have a custom template, so we are leveraging some of the things that Simplifier offers us. And you can, if you look into our IGs, they all share like a uniform structure. So we try to be easy implementable, that if you have looked at one IG, you will recognize the structure in also other IGs, right? And for version control of our IGs and also other software stacks that we're using, we're hosting it all more or less open source on GitHub. We're also using GitHub for issue tracking, and yeah, also there's a wiki on there and so on. Yeah. What we then do is our IG pipelines look like this. So our modeling teams or profiling teams use Forge or Fish Sushi, right? It's open. You can use whatever you want, but you have to agree in your team, right? For profiling FHIR, then we have a CI/CD pipeline where most of the repositories use the FHIR terminal as GitHub actions. So we have validation on commits. And then we have GitHub integration via Simplifier, so that if you commit your profile updates to GitHub, it will automatically be pulled into Simplifier and updated inside of the IGs. Then finally, our IGs are published to the FHIR package registry, where they can be integrated into FHIR servers and used for validation and conformance checking. Some more features which we are using is, for example, all the modules publish a capability statement resource that contains all the resource types which you need to support if you want to support the module from the core data set. And since we are research-based and it's so focused on to make the data searchable in the end, most of the modules also contain search parameter resources to make those elements in FHIR resources searchable, which are not searchable by the core spec, right? And this was also a topic like at the last WGM or here, multi-language IGs, right? We are doing this via Simplifier right now. So in some of the modules, it's work in progress. So in some modules, you'll find an English version IG, although we started only building German IGs, and now we are adding some of the IGs in English language. What we also have on some profiles right now is that the structure definitions, like all the conformance resources, value set, code system, etc., utilize this translation extension here. Yeah, that you have the names, titles, description of the structure definitions, also with translations into English language as a first step to have it in multi-language environments. What we also introduced during the course of this implementation is to have naming conventions on structure definitions and so on. Yeah, because we had so many modules and they were like a mess and difficult to identify. This is why we recently started to have, at least on structure definitions, value sets, and so on, the elements name, title, ID, and canonical URLs with naming conventions to make the IGs more readable and the resources more readable. This is an overview of the FHIR resource types, which are available in the current implementation. So if you want to work with the FHIR data, which the hospitals offer at the moment, you will find patient resources, you have the procedures, conditions, so diagnosis and so on, encounter data. You have some medication data. Then you have on the left-hand side here most of the lab data, where we also started using LOINC, as I mentioned before. And then there's some biobanking data, so specimen resources mostly. Yeah, and what we also have is consent. So whenever patients make their data available, it's covered by FHIR consent. Yeah. I'm going to cover some of the extension modules, which we're going to be adding in the future, really briefly here. So we are using the molecular genetics profiles and almost entirely derive them directly from the HR7 genetics reporting IG. There is a pathology report coming up at the moment. We have biosamples in production, specimen resources. Oncology is currently work in production. We are planning to have symptoms and phenotyping data on patients, where we are looking at the phenopackets IG at the moment. And there is intensive care data, where they also have more like they're going in the device direction, so device metrics for settings and measured parameters. there is microbiology data currently also developed. Okay, so I mentioned consent before. So the idea is that when we have patients in the hospital, we have this concept of broad consent, so that the patient can agree to share their data also for future research projects. And this is where we cover it by consent resource, right? And then the data can be made available in data integration centers and then be retrievable from the central services for scientists. The thing that was launched just recently is called the German Portal for Medical Research Data. This is where you can apply as a researcher, central portal to submit feasibility requests. It's made by FHIR search, so you can say something like, give me all the patients with like diagnosis XY, and then the platform will tell you like how many patients are there in the combined university hospitals, and then you can send a request to get access to the data and do research projects on it. Outlook. So we are still updating, refining the base modules, which you just looked at. We will release the extension modules for like the more complex clinical use cases. We are super interested on data analysis on FHIR, because this is where we don't have a lot of experience right now. Like things you saw here, SQL on FHIR, SQL and so on, will become more important for our researchers to work with FHIR data. And what we're building right now is also central terminology services. So have a terminology server, and then you can access them from different university hospitals to do like terminology validation and so on. All right, contact. Find me on the Hoover app, send me an email, or just use Zulip, and Q&A. Open for questions.
For this clear presentation of the Medical Informatics Initiative. So we have a few minutes for questions. If anyone has a question for Julian. Yes.
Hi, thanks for the presentation. Nick from Austria here. You mentioned this broad consent. Is it then giving like in a special field, or is it like a broad consent for everything that is coming up? Or I'm saying like at that topic, I'm giving my consent, for the other ones, not like that much?
Yeah, you can refine it. So if you want it really broad, then you can say like, take all my data and make it available in like this platform, but you can exclude certain fields, like in like this consent, you could say something like, take all my usual clinical data, but exclude my genetic data, for example. Yeah, you could do this, yeah.
So actually, I had a question. So
sure.
Is there anonymization of the data?
Yeah, so it's pseudonymized, yeah.
Okay, so there is consent then. Okay,
yeah.
Thank you. So I think if there is no further question, then we can thank again Julian, and then wish you a good day.
It's